Today I'm going to talk about the top 3 rashes that are most common in the first 6 months of life, what you need to know, and what you can do to help treat them. I'm pediatrician Dr. Tanya Altmann. The first rash we're going to talk about is diaper rash. And when babies are born, that first stool they have is really thick and sticky. It's called meconium. And so often I like to prevent diaper rash by using a clear ointment on their bottom every time you change the diaper. And this also helps the stool wipe off really easily. Now this can prevent a lot of diaper rashes by forming a little barrier between your baby's sensitive skin and whatever's coming out of them and sitting in the diaper. That said, sometimes you will see a little bit of redness. And when I see that redness, that's often when I recommend using a more thick, white zinc oxide diaper ointment with every diaper change. And this will actually form a thicker barrier to help allow the skin to heal and repel any moisture or other things in the diaper. You can also put some breast milk on your baby's rash on the bottom to help it heal, as breast milk is used for so many of these situations. Now, if the rash isn't getting better with the breast milk or your favorite diaper ointment, or it's getting much more puffy and red with little spreading dots, then you may be looking at a secondary yeast rash. And this is when it's a good time to call your pediatrician, as they will likely recommend an over-the-counter antifungal cream to put on with every diaper change. And sometimes we even layer it with the thick diaper ointment on top. If things again are getting worse, make sure you send a picture or visit your pediatrician, because sometimes we need other medicated creams to help more severe rashes heal, as it can be uncomfortable for your little one. The second rash we're going to talk about is cradle cap. Now, cradle cap is essentially the equivalent of baby dandruff. It's that thick, scaly, yellowish flakes that you might see on your baby's skin. And sometimes babies without hair will get it, and sometimes babies that have a lot of hair will get it. So we often treat it differently depending on if your baby has a full head of hair or not. So again, breast milk can be useful. A lot of parents also like coconut oil, and you would just put the mixture on your baby's head, let it sit, and then comb off all of those loose scales. Now, when there's a lot of hair, sometimes a shampoo can work better. So there's many cradle cap shampoos over the counter. When it gets a lot worse, we'll often even use a medicated shampoo. So that's when you want to call your pediatrician. And some people just use some clear ointments as well to help loosen up those scales. But again, make sure that you brush or you gently flake them all off, because otherwise they're not going to go anywhere. So you actually do have to remove them. The third rash we're going to talk about is baby acne. And yes, babies do get acne too. It's not dangerous. It usually appears around 2 to 3 weeks of age and will go away on its own around 3 or 4 months of age. But often it disturbs parents, even though it's not dangerous, and it can often interfere with your baby photo shoot. So what I usually recommend is taking a little bit of gentle, hypoallergenic, unscented baby wash and using a soft washcloth to gently exfoliate over that acne. Often just simple washing is all you need to do, and it will clear up on its own. But for more pronounced cases, we often will recommend an over-the-counter or prescription medicated ointment or oil. And again, breast milk often helps as well. So if it's not going away, if it gets worse, or you need some help clearing it up for that photo shoot, just reach out to your pediatrician and they can help you with what to put on your baby's skin. If this video helped you and your bub, please like and subscribe below.